Breast cancer is important to women, and it's no wonder. It's the leading cause of death of American women ages 35 to 50. Lack of family history offers little peace of mind, since 8 out of 9 breast cancer patients do not have a direct relative with the disease. And it's not just an older woman's disease. More than 250,000 women under 40 are fighting the disease. And diagnosis within 2 years of childbirth has an almost 50% death rate within 5 years. 70% of women who develop breast cancer have no identifiable risk factors. To help improve those statistics, NeoMatrix has developed the HALO Breast Pap Test to help detect abnormal cells in breast fluids. It collects tiny samples of fluid normally present in the breast ducts of all women. As is the case with Pap tests for cervical cancer, abnormal cells in the breast ducts are associated with an increased risk of breast cancer. Nearly all invasive breast cancers begin in the breast milk ducts. Multiple clinical studies reached this conclusion. Women with abnormal cells in their breast ducts are 400 to 500% more likely to develop breast cancer. Because it's slow growing, there's an average of 8 years before it can be detected by mammography. Now, using the HALO Breast Pap Test, cellular changes can be found years before a mammogram or self-examination would reveal a lesion or lump. The 5-minute HALO Breast Pap Test can be administered in the doctor's office as part of a regular visit. It's designed for all women 25 and older, whether or not they've had children or breastfed. It is safe and has no side effects. Some women find it slightly uncomfortable, but not painful and well worth it. This test is so new, it's not yet covered by most insurance policies, so the patient cost is around $100. Here's how the HALO Breast Pap Test works. After cleansing the nipples, adjustable cups are fitted to both breasts, and the 5-minute test cycle begins by initiating gentle suction, similar to that of a breast pump. Simultaneously with suction, the system automatically warms the breasts and gently massages them to bring fluid to the surface of the nipple. The breast cups are removed, and fluid is collected with a swab and sent to a laboratory for analysis. Finding abnormal cells in the breast does not mean cancer is certain to follow, and in fact, the body often corrects the abnormality itself. But abnormal cells do indicate an increased risk of developing breast cancer and alerts you and your doctor to monitor your breast health more closely. Not all women will produce a fluid sample, and lack of fluid in the ducts is a normal result that indicates a woman is at normal risk, not elevated risk for breast disease. But it's important to continue regular breast exams as recommended by your doctor. The HALO Breast Pap Test does not replace mammograms and breast exams.
Well, the potential of the breast pap test is that we can actually identify women with atypia who actually require intervention. So with those women, we have, in some cases, medication to offer, in some cases, what we call therapeutic lifestyle changes to offer her to help reverse these changes, and we actually potentially have the ability to decrease the incidence of breast cancer.
The HALO Breast Pap Test is FDA approved, and there's more information about clinical studies, the effectiveness of breast fluid analysis, and abnormal results in the comprehensive HALO Breast Pap Test brochure and website. Early detection is the key to surviving cancer. And now the HALO Breast Pap Test from NeoMatrix allows women to benefit from early testing. It's a quick, well-tolerated, affordable 5-minute test in your doctor's office during a regular exam.
The breast pap test will allow me greater peace of mind in knowing that I either A, have no abnormalities in the cells, or if they do find any abnormalities, that we were able to detect it as early as possible.
I think that it's a wonderful tool in detecting breast cancer, and it will continue to be part of my healthcare routine.
It's time to reduce breast cancer deaths with a tool that can detect abnormal cells years in advance of a mammogram or self-examination. The HALO Breast Pap Test.